Hi, this is Cernuska, and my project topic is mental health screening in pregnancy. The purpose of the project is to implement a maternal health screening assessment with a mental health screening tool in an obstetric office during the last trimester of pregnancy. Locally, in Uniontown, Pennsylvania, the Healthy Beginnings program provides home visits by experienced OB nurses to their high-risk patients. Currently, the program does not include a mental health screening. My PICO question is, in pregnant mothers in the Healthy Beginnings program, how does the implementation of conducting a mental health screening tool compared to no mental health screening affect patient outcomes within a 3-month period? My population is pregnant mothers in the Healthy Beginnings program. My intervention is conducting a mental health screening tool as compared to no mental health screening for my comparison, to see what the affected outcomes are in the last trimester of pregnancy, which is a 3-month time frame. My literature search included databases, CINAHL, EBSCOhost. My search terms and key terms were mental health in pregnancy, anxiety and depression in pregnancy, suicide in pregnancy, complications of mental health disorders in pregnancy, mental health screening in pregnancy, mental health screening tools, and mental health visits for treating mental health disorders in pregnancy. My articles and references totaled 51, and they included both qualitative and quantitative articles. The synthesis of knowledge is pregnancy can be very stressful, causing women to experience anxiety, depression, and mental health disorders, and can prevent normal everyday activities to be performed. 1 in 4 pregnant women experience mental health disorders. Numerous researchers concluded that there are various negative outcomes associated with mental health disorders, including emotional problems, a higher risk of obstetric complications, and the baby could have cognitive deficits. Less than half of the 20% of mothers experiencing mental health disorders during pregnancy or after birth are not receiving the help they need. Researchers recommend the utilization of the EPDS screening tool in the antenatal care setting, which allows for early detection and early treatment of mental health issues. The Healthy Beginnings program does not utilize a mental health screening tool to identify pregnant patients at risk for mental health disorders. One of the universal screening tools is the Edinburgh Postnatal Depression Scale, EPDS. The EPDS screening tool can be used to identify antenatal depression and anxiety. Researchers concluded that home health visits, including education and counseling during and after pregnancy, will lead to improved outcomes for mother and baby. The findings from the evidence does support my PICO question. Recommendations is to provide maternal mental health screenings with the patients in the Healthy Beginnings program during the 3rd trimester of pregnancy, utilizing the EPDS mental health screening tool to conduct the screenings. Repeat the screening on the follow-up postpartum home visit. Based on the results, then we'll make proper diagnosis of mental health disorders, provide referrals, and treatment as needed. In conclusion, researchers identify pregnant women as being at a higher risk for anxiety, depression, mental health disorders, cognitive defects of the infant, and even suicide. For improved outcomes, healthcare providers must conduct early mental health screening to make the diagnosis early and provide the proper treatment. This concludes my presentation. Thank you.